My own wife, Amy, usually sleeps like a baby, but lately she hasn't been sleeping well and she's wondering, is there something wrong that can be fixed? Well, EP Preventative Care says, oh yes, you need to check that out right away, and yes, it can be fixed. Joining me now is nurse practitioner Maribel Magallanes. Nice to see you, Maribel.
Thank you so much for being here.
Let's talk about menopause. Of course, my wife is well into her 50s, but you're saying this could be related to a woman's hormones. Talk about that.
Yes. Well, we usually, as females and males as well, we start having the symptoms of like the changes, hormonal changes 10 years prior getting to the menopause.
Wait, 10 years?
10 years prior.
So that means a woman could be in her 40s and start feeling, well, what do you feel? Because Amy was complaining of like her hip hurting and she's just not sleeping well.
Well, usually the symptoms are going to be fatigue, brain fog, joint pain, difficulty sleeping, low sex drive, depression, anxiety. Like you start gaining weight, like all of a sudden you start losing hair, but you just don't feel like yourself.
Wow. Okay, so if they come to EP Preventative Care, what do you do? How do you start this process of getting people well?
Well, we usually focus on getting to know the patient. We ask you like the questions on how you're feeling. We get your blood work. We get it at the same appointment. Usually the patients come in fasting, and we draw their blood work and we get our results in 1 week. In 1 week, we follow up.
In 1 week, you follow up. Now, do you have to start at a primary care doctor in order to be able to come to EP, or can you start the process here?
Well, you can start here. Actually, I'm a primary care provider, so we can go ahead and do everything here so you don't have to be going from doctor to doctor. We focus on your care here, totally.
Okay, let's say you discover that a woman's blood work says yes, your hormones are out of whack. What's the treatment? How do you fix this problem?
Yeah, well, we can do hormone replacement. I usually recommend for females mammogram and a pap smear, and we can go ahead and see which therapy do you want. We have different therapies. We have patches, we have creams, we have tablets. We can go ahead and have the pellets. So we have different options for everybody.
So Maribel, let's say you start treating a woman. What changes? How does she feel the difference?
Well, they're gonna start feeling more energy. They're gonna notice that they're able to sleep better. Joint pain improves right away. Brain fog, sex drive. They're gonna notice that they just feel better.
You were also saying that in addition to women, men also go through a situation where their hormones change and they too feel fatigued. Really?
Yes.
Tell us about that.
Yes, especially if you're having a lot of stress, if you're not sleeping well, if you don't exercise. Well, pretty much everybody, we have a lot of stress. And we also do the same thing. We do your blood work and then we go from there, depending on your hormone levels.
It's a testosterone issue. Is it natural for a man to kind of have lower testosterone through life?
Well, usually it starts getting lower at age, like around age 30, but we have noticed that younger patients are having very low numbers even at younger ages. And that is just lifestyle, we're always stressed.
Right. Mm-hmm. And of course, EP Preventative Care can also take care of all the yearly things, the mammograms, all the things you recommend in a very intimate and beautiful setting, I might say.
Yeah. We do pretty much everything here. Prevention, primary care, chronic care, if you're sick, everything.
Maribel, thank you so much. More information, go to our website, ktsm.com, click on that Studio 9 tab.